Why, thank you. So once again, I'm Kimberly Scott. I'm a medical affairs clinician for Merz Aesthetics, and I get the great privilege, thank you for having me, of speaking to you all about Radiesse in the context of beauty below the belt. Quick disclaimer, some of the indications that I will be covering today are not approved by the FDA or by Health Canada. And I think most importantly, we have to talk about the components of the Radiesse syringe and what makes it unique compared to other dermal fillers on the market. So Radiesse is composed of 30% of the substance in the syringe are these calcium hydroxyapatite microspheres. They're spherical, they're highly homogeneous, minute, and they're suspended in this gel-like carrier, which is the carboxymethylcellulose gel, making up 70% of the components in the syringe. And not only is it a carrier, it's a very elastic gel, leaving you with a nice lift and contour as a dermal filler. The lidocaine plus with Radiesse also contains 0.3% lidocaine, and both of them are housed in 1.5 cc syringes. We talked a bit about the extracellular matrix today, and these are some of the key components that are potential targets for regeneration. The main ones being fibroblasts, collagen type 1, collagen type 3, elastin, and proteoglycans. We're going to talk about each one of these individually and get a little bit deeper into the science. The first one I want to touch on is fibroblasts. So according to the picture on the left, more youthful fibroblasts are between the ages of 18 and 29. Those fibroblasts, when our tissues are more youthful, are stretched out, kind of like starfish on the bottom of the sea. They are attached to our collagen bundles. And while they're attached to those collagen bundles, they are synthesizing collagen and key components within the extracellular matrix. However, through the process of aging, as we start to dismantle those collagen bundles, as they begin to break apart, through the process of aging, we lose that mechanical stimulation and that direct contact of the fibroblasts. Once those fibroblasts lose contact, they go into more of a senescent state where we start to see collagen degradation and loss of that synthesis. After all of the talks that I've heard today, I don't think I need to define regenerative aesthetics. So this slide demonstrates in the white sphere is the calcium hydroxyapatite particle. And the green substance on the screen are representative of fibroblasts. And basically, the calcium hydroxyapatite particles act as scaffold for our fibroblasts to come in contact with and then create that mechanotransduction leading to the synthesis of those key components of the extracellular matrix. So collagen type 3 is essentially a blueprint for collagen type 1, helping with skin density, skin thickness, also improved skin surface regularity, elastin improving laxity of the skin, and then proteoglycans is that hydration and hyaluronic acid. This is a bit of a busy slide, but on the bottom left is one of the more important charts that we talk about when we talk about Radiesse effects on collagen. You can see the collagen type 1, type 3, and elastin at baseline. And then at the 4-month mark with the 3 asterisks above that middle line, we can see that the collagen type 3 is quite appreciated there. And then once you get out to the 7-month mark, we can see a statistically significant growth of the collagen type 1 as well as elastin. The pictures in the center is elastin and stained in brown. Again, you can see the brown staining at baseline and then the improvement at 6 months in that brown staining, hence elastin. Proteoglycans, this is one of my favorite images, you can see the thinning of the dermis, surface irregularity at the dermis in the baseline photo. And then at the 6-month mark, we start to see that depth being created, and those finger-like projections are called reedy ridges. And housed inside those reedy ridges is our hyaluronic acid and hydration, kind of giving our skin a little bit more of a glow and that hydration look. The angiogenesis or neovascularization was found in a dental study where they were actually using Radiesse for regeneration of recessed gum tissue, and found, followed out to 12 months, that there was evidence of neovascularization, new cells, hence new blood flow. So the purpose of this slide is really just to, remind everybody that Radiesse is a dermal filler, and it is the highest G' dermal filler on the market. You can see that represented by the black line, that it is, and high G' means it's got great lift capacity, and volumization to be able to sort of lift when you're using it in the face and reposition the medial face. 1400 plus G', and it's still a biostimulator at that standpoint. However, once we start adding diluent and we reduce that G', even at a 1-to-1 dilution, you can see that G' goes down to 40, but that's where we tend to see that heightened degree of collagen and regeneration, which we will get into a little bit further. So obviously this is beauty below the belt, so we're going to talk about some of our more recent publications on the indications, which are off-label indications for Radiesse for below the belt treatments. On the bottom left, this particular publication was utilized in a quite an interesting way, where they use multiple different dilutions as well as different planes of injections depending on the indication that they were looking to treat. Cellulite was treated at that 1-to-1 dilution. In the superficial subcutaneous plane, with that 1-to-1 dilution, we're adding shape and volume in that deep subcutaneous plane. And then for tissue irregularity, sagging, laxity was at that 1-to-4 dilution subdermal. And this is a bit of a busy slide, but it gives you some nice pictures of before and afters. Some of these were photographed at 90 days post, some of them at 180-day post. On the slide, you can see sort of the formula that was used to obtain those results, but these patients were quite happy and followed out to 36 months with some evidence of skin quality improvement, filling, projection, as well as cellulite reduction. This is another nice before and after, where she wanted a little bit more rounding and projection, rounding of the upper glutes. Treatment protocol used for this particular model in this particular study was 10 syringes of Radiesse, 5 syringes per buttock at that 1-to-1 hyperdilute treatment regimen in the superficial subcutaneous space. I don't know if this was a Ozempic patient. However, we had some conversations about Ozempic at length today. And this is an extreme weight loss patient. And you can see at baseline she had a lot of laxity, a lot of surface irregularity, evidence of dimpling, and underwent 2 treatments with Radiesse injected in that subdermal plane, 4 syringes per treatment at the 1-to-1 dilution at 6 months. You can see she's had a pretty nice, remarkable improvement of her tissue laxity, as well as skin quality improvement and cellulite reduction. This is another patient that was treated with 1 syringe of Radiesse, diluted at the 1-to-3 dilution ratio, and that 1 syringe was divided between both of her knees, so not a significant amount of product. And I think it's, again, quite clear to see that she had some improvement of her laxity, as well as some volume component that you can see from the collagen production, and this is after 4 weeks. And real quickly, just in summary, just a reminder that Radiesse is a dermal filler. It's a regenerative dermal filler that gives you that immediate volumization, but it regenerates multiple components within the extracellular matrix. You get more bang for your buck with Radiesse. It is the highest G' dermal filler on the market, and restoring that extracellular matrix back to its functional state. And the buttock study that I had shared was followed out to 39 months with very positive, satisfactory results. And Merz wanted me to leave you with this slide at the very end indicating our entire portfolio. And if you have any additional questions, I am here for the rest of the day. Otherwise, I think there's a way to reach out through the platform as well to send any questions that you may have. Thank you.